All right, so raise your hand if you have GERD. Okay, so a lot of people have GERD, and we're going to talk a little bit about GERD today. Again, it's a very common thing. So yeah, if you have any questions, reach out in the comments. So the biggest factor for GERD is a hiatal hernia, which is when your bowel sticks into the diaphragm, and that causes pressure. So we'll talk about that a little in a different video, but I just wanted to explain briefly what that was. And then so it's a lot about your sphincter and how it opens and closes. You know what I mean? So if you've ever seen a baby, vomit, basically they just kind of open their mouth, right? And they vomit. There's no retching sound really. And there's no lead up to it. They just vomit. And that's because their sphincter is not developed appropriately yet. So let's just talk about some symptoms of GERD. So heartburn is definitely the big symptom. So heartburn is basically a burning type feeling in the lower sternum area. And then it can spread upward to the throat and the jaw. And we want to be sure that the patient really has heartburn and not having, chest pain. Yeah, and then also dyspepsia, which is pain in the upper abdomen. And regurgitation, which is hot or bitter or sour liquid that comes into your mouth. So those are the symptoms, okay, of GERD. And now we're going to talk about when you need to worry, really. So basically, you need to worry about esophagitis, which is inflammation of the esophagus. So basically, if your GERD is if your GERD is uncontrolled, you can have esophageal inflammation. And then also, you can get Barrett's esophagus. Only 5 to 15% of the cases have it, but that's a precancerous lesion in the esophagus. So yeah, and then there is a potential for asthma, and there's dental erosion a lot because the acid's coming up into your mouth. So we want to encourage our patients to have meticulous oral hygiene. That they really brush their teeth enough and that they really rinse and, whatever, because acid is extremely dangerous for the teeth. And we don't want the patient to have teeth erosion. So for diagnosis, a lot of times they use a barium swallow. So basically it's going straight down. So they'll have a person sip on something. So that way they can see the narrowing of the esophagus if it is narrowed. And that's really important. And they can also do an endoscopy. So they can go down with a tube through to see your esophagus and your stomach and see what is there. And see if make sure there's no tumors causing this to happen. And then they can do a motility test, which is not very common, but it's 24 hours in the procedure room where they kind of watch you get a certain amount of food and you get to eat it. And then they kind of watch it go through your digestive system. So they can check on is it, going too fast? Is it going too slow? Is it, where is it stopping? Stuff like that. So, yeah, so some drug therapies are PPIs, which are proton pump inhibitors. So these decrease the hydrochloric acid in the stomach. So basically you have a lot of acid in your stomach, and that's what's coming up and that's why you have heartburn. So to decrease that acid, we're trying to relieve some of the pain of heartburn. And then also, so Prilosec is like one of the most common, but you have to watch for headache for that, and stop it if you have a headache. Well, don't stop it, but like talk to your healthcare provider about what you should do. Okay. And then there's H2 receptors, which I talked a little bit about in the previous video, I think. But these are just like receptors. They block the H2. So this blocks the regurgitation, tries to. And then there's cholinergics, and that gets it through because sometimes we have decreased motility, and that is the reason that we're having, this regurgitation into our esophagus because there's too much food, or yeah, too much food. So that's basically the lowdown on GERD. Again, that's very like simple. If you have any questions, feel free to reach out. Good luck, guys. I know you can do it. Go nursing.